I'm Audrey List, and I will be discussing the perfect stop button. I want everybody to close your eyes and think of your absolute worst memory. Now, imagine that memory is a movie, and imagine that the device that movie is playing on is broken, and that memory keeps playing over and over and over again, and you have absolutely no control over when that decides to play or not. This is an introduction to what it would be like to have PTSD. You have the emotions of anxiety because you don't know when that play button is going to hit, and so you're scared about when it's going to hit. You're sad because the movie that you have to watch is so detrimental to you and so depressing. And you're angry because you don't have any control over when when the play button starts. Wouldn't it be nice if there was techniques that you could use in order to help press that stop button? One of the main techniques that has been used in recent years is called EMDR, which is rapid eye movement. In doing this presentation, I was trying to figure out if EMDR was more effective with people with PTSD compared to the traditional cognitive behavioral therapy. For EMDR, they use rapid eye movement, so the client would use, the therapist would do eye movement while the client focused on that movement in order to subconsciously process the trauma. The different tools that are used, like you can see here, they do a 2-finger process where they just follow the finger. They also have what are called buzzies, which are more of a tactile approach where they set the frequency of the buzzies in the hand. They have a similar one that's an audio version of that, so they'll have different bells that will go back and forth. And then the light bar is similar to the finger, it's just not as hard on the therapist. So they would do it for a short amount of time, process what came up in the client's head, and then continue to go through the session. The studies have been done. Dr. Stephen Taylor mentioned that many of these interventions include imaginational exposure, free association, and finally they recall the trauma while attending to the auscultatory movement. Dr. Nassim Jabarghari, he's from Iran, they actually did a study with Iranian girls who had been sexually abused to see if it was effective. And after 12 sessions of that study, they found that there was a significant decrease in the symptoms of their PTSD. The other side of this is exposure therapy, and I mentioned before the cognitive behavioral therapy, that aspect of it is the exposure therapy. In exposure therapy, they will slowly take steps to expose you to what your traumatic event was. For example, let's say that you were abused in a movie theater. So you have that memory play every single time you think of a movie theater, or you're anywhere near a movie theater or anything like that. And so with exposure therapy, you would sit there, and in the beginning you would work on coming up with a safe place that you could go in your mind that would keep you calm. And once you establish that safe place, you would be able to start the process of getting closer and closer and closer to actually being able to be in a movie theater. So you would start off by maybe you were in the parking lot and you would make sure that you were calm and safe, and you would usually do this with your therapist. So you would be in the parking lot and you would see where your anxiety levels were, if you were triggering or not, and if that was okay, maybe you walked up to the door and you stood outside the building and you would do the same thing. Do you feel safe? Are you triggering? Are you okay? This process would continue until you would be able to go into the movie theater and be able to sit there without having any triggers or flashbacks. In comparison, both of these therapies have been proven to be effective for PTSD. So my thought was, wouldn't it be the best for our clients to have those multiple options? Because sometimes EMDR doesn't work for certain people, and sometimes exposure therapy works better. And so if we're able to help our clients, it would be better to do that the best way that we can.